An injury in an athlete can be of two types. One is an acute injury that happens at a given point of time and it happens suddenly. And another type of injury is a chronic or overuse injury. Uh, Giving an example, the fracture that Shikhar Dhawan endured in his bottom hand is an example of an acute injury. Acute injury. Uh, a sports physician or a physiologist or a physiotherapist is not in a position to prevent such an event from happening. So that is an acute injury. An overuse injury is one wherein the muscle, the connective tissue covering the muscle, which is called fascia, or the tendon by which the muscle gets attached to the bone, are affected by a repeated overuse. So there are a few overuse injuries and they are usually classified as enthesopathies, the attachment of ligaments, and tendinopathies, where the tendons are attached. Now, what are the classical examples of tendinopathies? The whole world and the whole of India came to know of one particular overuse injury, that is the tennis elbow, when the master blaster Sachin Tendulkar was diagnosed with it. That is basically an inflammation of the common extensor muscles. So, in your forearm are the muscles that cause extension. This is the movement called extension. It causes extension at the wrist. Now, this movement, when done in full elbow extension and there is wrist extension that is being done, there is a stress placed on the common extensor origin, also called the lateral epicondyle of the arm bone, which is present over here. So the lateral epicondyle is where the muscles that cause extension of the wrist originate. So repeated bouts of activities or faulty technique can result in a lateral epicondylitis. Lateral epicondylitis is now called a tendinopathy. It is not called tendinitis or a tendinosis. It is now called a tendinopathy, which basically means there is a disease of the tendon, and the disease of the tendon is because of a failed attempt at healing. So the microscopic findings that we find in these muscle tendon tissues is that there is an angiofibrotic dysplasia, which basically in normal language means that there is excess formation of blood vessels and fibrous tissue in that particular region, which is causing further impairment of the movement and difficulty in playing a particular sport. This is one example of a chronic